What I decided to do was talk about new things and a little bit of old things, because people get tired of hearing the same thing. But we have new things all the time, and I study them and I teach them. And when the new things come out, I have to study them in order to teach them. So it's a continuing process, and actually I enjoy it. I enjoy dentistry, so I think I'm very blessed. So what's new? Everything digital is expanding rapidly. It's now possible to take images of patients' skulls and design implant positions, look at the bone implant guides, make abutments, and design the crown. And one scan and they do it all. Entire dentures can be done by taking a scan of the denture, taking pictures of the dentures. And instead of making it the old way, packing it and making base plates, they can grind one out of a piece of plastic. Crowns and restorations can be done in the office if you want to purchase the $130,000 machine. It doesn't end there. You have to buy an oven, and it takes a lot of expertise, which I'm very happy to let technicians take care of. So it's a choice. The downside, all of these new technologies are very expensive. The machines cost $130,000 plus. The imaging machines, I mean, I can buy one, have it in my office if I have room, $130,000. So rather than do that, I send my patients to the lab. They can have it done about $100 to $200 cheaper when they go to the lab. So hopefully the cost will come down someday. In our office, we have a new system now called Revenue Well, and it texts you or emails you your choice to confirm your appointments. Some of you have already experienced that. Some of you that are patients have already experienced that. Then we have now tried care credit financing for patients that don't have a lot of money. They can go to a company that will finance everything, and we get out of the picture collecting money, which is very good because it can become contentious. And then, of course, I've had digital x-rays since 90. That's when it came out. So this is one of the new types of crowns that we have here. It's made out of zirconia, which is the same material as the Yoshi blade that you see on TV. And Guy knows all about zirconia because they make artificial diamonds out of it. It's very hard. It's very strong. It's so strong and hard that I have to be careful and look at what's here. If they have an old style porcelain crown there, I might have to think over making this crown here because it's so strong it might chip this one, because the old style chips much easier. So you have to know the high tech, you also have to know what you're doing with it. And I made a zirconia bridge. This is what it looks like when you don't have the bridge. And this is the zirconia bridge. It's all zirconia, no metal. People that are talking about metals and things. This is dynamite. It looks great, very strong, and it's excellent for this patient because this patient is a grinder, grinds his teeth. And these are made specifically for that. All right, I've made the old style porcelain bridges for patients where they've destroyed them in about a year, and I had to make it good. So remake it with a different material. This is Emax. This is lithium disilicate. It's really beautiful. I do it on anterior teeth. Some of you have seen them on my other presentations where the gal went from 60 to 65. She looks better at the front teeth. That's Emax. And it's really wonderful stuff. Stronger than porcelain, not as strong as zirconia, but really, really beautiful. And it's best on the front teeth and the bicuspids. What has not changed? The bite has not changed, will never change. Your teeth, the shape of them, the way your jaws move, never changes, you know, human being. Making the new restorations fit the bite is the key, because they're stronger, harder, and less forgiving. So if you're not really dynamite with the bite like I am, you can have problems with the new restorations. They could be uncomfortable. So I threw this in for Mike and Val. This is a bridge that wasn't done in my office. Implant bridge. These are all implant abutments. 1, 2, 3. This is a false tooth. That's why they call it a bridge. But the one of them failed. And I believe it failed because the bite was crooked here. And when he came in, the bite was way off. I had to take this down quite a bit. In fact, most of the pressure in his mouth was on this one tooth. So the implant failed, and the bone around it was abscessed. So I had to take it off. And you'll like this, Mike. This is a torque wrench.
That's 100 foot-pound?
25 newtons. They give it in newtons there. There's the bridge out. There's the torque wrench. So pretty cool. This is what we use nowadays, to put them on, take them off. And this is a case that I'm going to do in a couple of weeks, which is why I won't be here on our Thursday, the 20th meeting, and I'll miss Gene's mixer. This is a case of a patient that had years of TMJ problems anyways, and I wore a night guard, which didn't do that much good. But then a dentist made her some crowns that didn't fit right and made her worse. And so this is her face when she started, and this is her face later. Now, if you really want to look at it, like the women know women, but you look at this depression in her face here, it's gone. And you look at the cant of her head, and you can tell by looking at the level of her earlobes. After I fixed her bite, her head straightened up. Her eyes are straighter across. And look at her neck muscles. This is all concerned with, if your bite isn't right, your muscles fight each other. You remember when you were in high school and you had to do that electronic charge to the frog gastrocnemius? An electronic charge hit the frog leg and it moved. Well, all of our muscles are the same, humans and frogs. We get electronic impulse from the brain to the muscle. And it's very complicated if you look at the muscles of the face after you skin the face like I have. But all the muscles contract at the same time, same message from the brain. But if it's not coordinated and they're fighting each other, then you have some swelling here. Then you have lack of development here. Then you have asymmetry in these muscles that turn the head. So there's a lot going on in one patient all the time. And if you're not super competent at correcting the bite, they'll never get well. And that's why a lot of dentists that attempt to treat patients with jaw problems, you sound like my wife. She says, you have 2 minutes. I sound like my wife. But where was I? Okay. So when the patient's muscles are fighting each other, they swell, or they become atrophied if they're not functioning correctly. And so she got well. Her pain got better. She's a lovely person, delightful brain. She's a Italian Renaissance teacher at Chapman College. She's a professor. And she moved away to upstate New York, and she came back to finish her treatments. So you can't see it here, but it says 10/26/11 and 5/29/12. And in that amount of time, look at the bend in her back. Okay. And I personally couldn't figure that out. I just observed it. But I had to consult with my physical therapist that treats some of my patients that need physical therapy for their muscles. And he says, if you get these, look at the way her head is positioned too. See how her head is more erect? Look at her chin. I didn't tell her to do anything. I just took a picture. See her chin? Now look at that. Look at her breasts look larger because she's standing up straight. And in the wax, they call that knockers up. Stand up straight, knockers up. That's a saying in the Women's Army Corps. But she looks totally different because she's relaxed here, the tension's gone. Tension's gone from here, and it allows these muscles to have normal contraction and straightens up her back. So that's my presentation. Quick, any questions?